Warfarin. Warfarin is a oral anticoagulant which is used to reduce the coagulation. Contents: definition, mechanism of action, pharmacological action, pharmacokinetics, adverse effects, contraindications and uses. Let me discuss in detail about warfarin. Warfarin is an oral anticoagulant which is used to reduce the coagulation. Mechanism of action: warfarin inhibits the vitamin K epoxide reductase enzyme. When we administered warfarin, so this warfarin will inhibits the vitamin K epoxide reductase enzyme. This enzyme is responsible for the activation of vitamin K. So now this warfarin inhibits the enzyme so that there is no activation of the vitamin K. This inhibits the synthesis of vitamin K dependent clotting factors 2, 7, 9 and 10. Means the clotting factors 2, 7, 9 and 10 depends on the vitamin K. Due to inhibition of the enzyme vitamin K epoxide reductase enzyme, there is no availability of the vitamin K. There is a lack of vitamin K, so that clotting factors will get inhibited, and also the regulatory factors protein C, S and Z. So these proteins also depends on the vitamin K. So the regulatory factors protein C, S and Z is depends on the vitamin K. So due to lack of vitamin K, there is no synthesis of clotting factors and regulatory factors, so that it reduces the coagulation. This is the mechanism of action of warfarin. Warfarin inhibits the vitamin K epoxide reductase enzyme. This enzyme is responsible for the activation of vitamin K. Due to inhibition of enzyme, there is no activation of vitamin K, so that there is a lack of vitamin K. So due to lack of vitamin K, there is the inhibition of the synthesis of vitamin K dependent clotting factors 2, 7, 9 and 10, and also the regulatory factors protein C, S and Z. So due to inhibition of these clotting factors, there is a inhibition of the coagulation or reduction in the coagulation. Next will be pharmacological action. The very first one will be anticoagulant action. So this warfarin, by inhibiting the vitamin K synthesis, it inhibits the clotting factors and reduces the coagulation. Second one will be antiplatelet action. By inhibiting the platelet action, means by reducing the coagulation by inhibiting the platelets. Pharmacokinetics: it is administered orally, and 99% of the drugs will bind the plasma proteins. To longer duration of action we can observe, and it crosses the placenta, so that we should avoid in pregnancy. It is metabolized in the liver and secreted through milk, so that we should avoid in case of lactation. Adverse effects: it causes bleeding, because not only this warfarin, almost all the anticoagulants or thrombolytics, so these are the drugs will causes the bleeding as an adverse effects, because these drugs we are used to reduce the coagulation, means clot formation. So when we are using these drugs to reduce the clot formation, so usually it affects the platelets also. So the persons who have bleeding disorder, for them it may cause increase in bleeding, and also it causes cutaneous necrosis. There is a cell death, alopecia, sudden hair loss, because it affects the hair follicles. Means particular part of the hair, you can observe in the peak, the particular part of the hair is fall down, we can see, because it affects the hair follicles, and it causes dermatitis, skin infection, and also it causes diarrhea, because you know well that oral drugs usually irritates the ZIT, that may cause nausea, vomiting, diarrhea. So this one means warfarin causes the diarrhea. Contraindications: so these oral anticoagulants means this warfarin we should not use in pregnancy because it crosses the placenta. So when it crosses the placenta in early pregnancy, it increases the birth defects, especially skeletal abnormalities. So it causes the skeletal abnormalities, so bone growth is not happen properly. In later pregnancy, it causes CNS defects, fetal hemorrhage, fetal death, neonatal hypothrombopenia. So that we should avoid in case of early pregnancy and late pregnancy because it crosses the placenta. So if the pregnant woman administer the warfarin, it crosses the placenta and enters to the fetus and it causes the birth defect. So that we should avoid in case of pregnancy, and also we should avoid in case of lactation because it is secreted in milk, so that it may cause adverse effects in babies. Uses: it is used in deep vein thrombosis, pulmonary embolism, myocardial infarction, unstable angina, rheumatic angina, hemodialysis. Deep vein thrombosis means here there is a formation of clots in veins. There is a larger clots in the veins. So in that condition we'll use pulmonary embolism. There is a clot formation in the lungs, myocardial infarction, heart attack, unstable angina, sudden chest pain due to blockage, rheumatic angina. Rheumatic angina means when we are not treated the fever, scarlet fever properly, that time it causes the inflammation and it later it affects the causes the angina pectoris, so that we call as a rheumatic angina. And also we'll use warfarin as a prophylactic purpose, means to reduce the coagulation during hemodialysis. So during hemodialysis, during blood purification, to avoid the clot formation in the blood, we'll use the warfarin. Next will be cerebrovascular disease. So the disease related to the brain. If any clots formed in a brain, to reduce that clot or its clots going to form means it's a for prophylactic purpose. We'll use the warfarin. And also it is used in vascular surgery. So any surgery happen in a blood vessels and prosthetic heart valves. So during artificial heart valves inserted in a heart in that case, and retinal vessel thrombosis means in a eye, in the retinum, if any clots are formed, so during that time also to reduce the clot formation we'll use the warfarin. And also it is used in extracorporeal circulation, artificial circulation, and also it is used in a defibrillation syndrome. So defibrillation syndrome means here formation of clots. So to reduce the clot formation we'll use the warfarin. Thank you.